This meeting is being recorded.
Okay. Is this good, you think?
Yeah.
Okay. So our group is group number 2. We're doing the complex case study on gene therapy, the biotech death of Jesse Gelsinger.
All right. So I apologize ahead of time if you hear kids in the background. So the story, like summed up, is this is an 18-year-old in a trial for gene therapy. Jesse was diagnosed at age 2 with OTC deficiency. I don't know how to pronounce that, so I'm not going to. It's a rare metabolic disorder that requires him to take 32 pills a day and eat a really strict diet. This disorder gets rid of enzymes that degrade ammonia in newborns, and ammonia accumulates in the bloodstream. So that leads to severe brain damage. And he wanted to be enrolled in this gene therapy study because, because he wanted to help other people dealing with it as well. But he ended up getting a lethal injection that counteracted with his disorder, and he ended up dying from it. And this trial was supposed to determine if the corrective OTC would help newborns with the fatal form of the disease, which automatically showed that Jesse wouldn't have benefited from this because his was controlled with 32 pills a day. Jesse still wanted to be a part of the trial, even though it would not benefit him, but he wanted to help babies diagnosed in the future. His family had not been aware that there were cases of many other patients that had experienced severe side effects during the study, and that 3 monkeys died from a blood clotting disorder and severe liver inflammation by being injected with this corrective gene. And failing to inform or get complete informed consent is against FDA regulations and is also against the good clinical practice guidelines. And so these are the ethical principles that I encountered when I was reading through this study. So beneficence, like doing what is best for the patient, even though he wanted to be a part of it to help other children, it wasn't in his best interest to be a part of the study, and the doctor shouldn't have allowed him to be in it because he was older and wouldn't have benefited from the gene therapy at all. So by letting him do this, it was not ethically sound. Non-maleficence, to do no harm. The doctors let him be a part of the study knowing he wouldn't benefit. And did not communicate the risks that were associated with the therapy. And that led him to ultimately die from respiratory distress and multi-organ failure, kidney failure, and a blood clotting disorder. Autonomy. Respect patients' self-determination. So by not disclosing the information about the monkeys specifically in this study to his family members, they took away his autonomy because he didn't have all the information he needed to make an educated decision. Justice and fairness, to treat and provide care fairly to all patients. Dr. Wilson from the University of Pennsylvania, and the other doctors had financial interest in this specific clinical trial, and this alone isn't providing fair care to him because whether or not the doctor's intentions were in the right place or not, being financially invested in a trial is a conflict of interest.
So for medical indications, Jesse's severe reaction to the adenovirus, which was the injection during the clinical trial, led to kidney, liver, and lung failure, which led to his death. The researchers ignored the principle of non-maleficence. After Jesse's death, it was determined his pre-trial test showed he had poor liver function, which was a pretty strong indicator that he should not have gone through with the gene injection, but they were not told this. And just to show a little accountability or a lack of accountability within the gene therapy research industry, in the 7 years before Jesse's death, there were 691 gene therapy volunteers that had died, but only 39 were promptly reported, which was an issue with this specific clinical trial as well. And then patient preferences. Jesse's diagnosis of OTC is what made him eligible to partake in this trial. He understood that he was not going to directly benefit from this, but as Robbie said, he wanted to help future children, and this was rewarding enough for him. As Jesse's death was investigated, it came out that there was some key information omitted. There was previously a few patients that had some pretty serious negative side effects that Jesse and his parents were not told about. And there were 2 lab monkeys that were killed due to the high doses of this adenovirus. And because of this, Jesse's autonomy was not respected. If this information was delayed, I think it's a pretty safe assumption that Jesse may have never taken part in the study in the first place.
I apologize in advance if there's any background noise. So for quality of life and the principle of beneficence, while looking at what the prospects were with or without treatment for return to a normal life and the physical, mental, and social deficits which the patient may have experienced, there were no direct prospects for Jesse's health in participating in this therapy due to it being an elective therapy, which was intended strictly for research. Jesse also suffered from a OTC deficiency before the study began, and he was not sick, but had to take many medications and follow a strict diet. The treatment that Jesse was receiving was said to cause bleeding from either the gene therapy site or subsequent liver biopsy, which would require surgery or serious liver inflammation, which could require an organ transplant and may lead to death. However, Jesse experienced multiple organ failure after he had received this therapy. On what grounds can anyone judge the quality of life that would be undesirable for the patient? The quality of life for this patient could not be perceived as undesirable due to the fact that Jesse had a very adverse reaction to the therapy, which cost him his life. So that's not a desirable quality of life for him. For ethical issues that arise concerning improving and enhancing the patient's quality of life, the ethical issues that arise concerning improving the patient's quality of life would be that Jesse did not necessarily benefit at all from this therapy. And it was an elective study, and he made a choice to take part in this study. So therefore, it's difficult to fault the provider for administering the medication, possibly, when the patient had fully consented to it. That's just one possible outlook on the situation. Moving on to the next slide. For contextual features, starting off, are there professionals, interprofessionals, or business interests that might create conflicts of interest for this clinical treatment? The professionals which may have an interest in this case would include the researchers who are studying the gene therapy being administered to Jesse. In addition to this, the company creating the gene therapy would have a vested interest in the efficacy of the therapy. The doctors may have wanted the gene therapy to receive publicity or monetary gain before it was ready for human administration. While talking about if there are any other parties other than the clinicians and the patients, such as family members who have an interest in this, the parties other than the clinicians would have been Jesse's family. While reading the New York Times article, it stated that he had a very close family who supported him. Jesse was technically a legal adult while making the decision to be a part of this treatment, but he was very young and the effects of this therapy were irreversible. Additionally, this study was proposed to Jesse when he was only 17 years old, a very impressionable age, and it may not have been an appropriate age for him to make this decision. Lastly, are there considerations of clinical research and education that might affect clinical decisions? Considerations of clinical research that might affect clinical decisions would be the effect that the gene therapy had on animals prior to being administered to people. The gene therapy was administered to a baboon, and the expected results of this therapy was expected to be flu-like side effects, along with some mild liver inflammation, which disappeared on its own. So in some regards, they may have thought while administering this to a person, it wouldn't make a huge effect on Jesse.
So when I first went through this case study, I originally thought that it was very unethical for Dr. Rapper to administer the highest dose of treatment to Jesse, especially knowing his pre-trial liver function. And I thought that it was unethical that he didn't inform Jesse's family about the cases where other patients experienced serious adverse effects, or that the test monkeys had died from receiving the highest dose of the OTC gene. It kind of seemed to me that Dr. Rapper purposely withheld this information for his own benefit in order to have more patients participate in his clinical trial. And then after going through all the questions and reflecting a bit, I still had a similar perspective. And I realized that the study mentioned not informing Jesse's family, but I couldn't find anywhere that specifically mentioned that Jesse wasn't informed. I think it was a gray area because it did all start with like presenting the trial to him at 17. And even though he was 18 at the time that it started, the family legally did not have to be informed. But Dr. Rapper also may have been encouraged through threats or compensation by the university he worked with not to report any adverse events or deaths that occurred during the clinical trial, which can make it a more difficult position than for Dr. Rapper. However, I still think that he was performing unethically from the start of Jesse's experience by not gaining informed consent. And I think even if he was in a tough position, he still should have disclosed any adverse effects from the gene therapy. So after going through this case, I thought that one of the ANA Code of Ethics that pertains to this specific scenario is 3.2, and it goes along with the informed consent that I just discussed. In the previous slide, it's protection of human participants in research. It states that participants must receive sufficient and relevant information to make informed decisions, and information for informed consent includes incidental findings, which in this case would be informing Jesse that his family that 17 other patients received lower doses, and he was the only one of 2 humans receiving the highest dose. In addition, the monkeys had died from the high dose of therapy, and that should have been disclosed. So in this case, the doctors involved in Jesse's treatment only had to gain informed consent from him, but it still seemed like they were withholding information in general before receiving his consent.
All right, so for alternative perspectives, my perspective from this case was the doctors who were involved in Jesse's gene therapy trial are at fault for his death because they did not completely disclose all the information to Jesse and the family about the serious side effects and potential death. This makes me think that if Jesse knew about all of this, he would have not gone through with the trial, because prior to this, he was able to manage his OTC deficiency well and was living a normal life.
And my alternative perspective was that Jesse was an adult who could make his own medical decisions, but lacked the full knowledge of what he was consenting to because all the risks were not disclosed to him. Ultimately, he was responsible for his demise because on paper he consented to the trial knowing it would not benefit him, but he wanted to do it to help future children diagnosed. And but his decisions backfired, but simply because the doctors who were supposed to have his best health in mind did not, and this ultimately led to his death.
All right, so for my alternative perspective, I said that Jesse's parents should have had a greater role in the decision-making for him to go through with the study or not. Since he was only 17 when he first learned about the trial, his parents could have had a greater stake in the process. Since Jesse was so young, he likely didn't know all of the necessary components of an informed consent document. And since his parents had to make medical decisions for Jesse throughout his childhood, they should have played a greater role in the paperwork and the research and decisions leading up to the procedure. So it seemed that Jesse was naive and hopeful that he'd be able to make a change for future individuals with his condition. But unfortunately, he didn't have the experience to understand the risks of participating in the trial.
I said that Jesse's doctor was at fault for his death ultimately because he did not inform him of the effects of the highest dose of treatment on the test monkeys and one other human who had received it. I thought if he had known all of this, I would assume that Jesse would not want to start with a lower dose of treatment, just as most of the other participants were.
And I said that Jesse is an adult that signed the consent form. He could have asked more questions or done his own research. The doctors performing the clinical trial told him the general information and he accepted the terms. His death was obviously unintentional and there's no way that they would have known that it would have killed him.
My alternative perspective is a bit similar to Robbie and AJ's in that I believe that Jesse is a grown adult and was able to make this decision on his own. So although the outcome was very sad, he was 18 years old and made the choice to take part in the study.
Sorry, that's me. My rebuttal to the alternative perspective is that the case study stated that Jesse's family was not informed of the serious risks, but never said anything about Jesse not being aware of the serious risks. I couldn't find anything about whether or not this was true or not, but for all we know, Jesse knew the serious things that could happen due to this gene trial therapy and went along with it anyway.
And then for my alternative perspective, I said that since Jesse was 18 at the time he participated in the gene trial, he was legally able to make decisions for himself without the approval of his parents, like a lot of you have already said. So ethically, Jesse had the right to autonomy and chose to go through with the trial on his own regard, despite the potential complications that occurred.
And I said that the doctors involved in Jesse's treatment only legally had to gain informed consent from Jesse as he was 18 years old at the time. It doesn't state anywhere that Jesse himself was not informed of the implications of the high dose treatment on the other patient and the monkeys, just that his family was not.
And my rebuttal is that although an adult, Jesse was still young and may have still had the mindset that adults and doctors know best. He was very trusting of the individuals putting on the clinical trial, but I still believe he should have taken the time to do some of his own research and ask more questions.
My rebuttal to the alternative perspective would be that although Jesse is 18 years old and that is considered legally an adult, we know that 18-year-olds are not fully developed. It takes until you're 25 to be fully developed and have your frontal lobe developed. So you have to be 21 to even drink or smoke. So why are we allowing this 18-year-old boy to take part in a study that could possibly kill him?
My alternative perspective is that it doesn't necessarily state, some of you have said this already, but that he wasn't informed of the serious side effects. It was just his family. And since he was 18, he's a legal adult to make his own decisions, which allows him to have full autonomy for medical decisions.
Okay, so for the legislative portion of this, I also focused on informed consent, which Francesca already talked about earlier. But according to the Code of Federal Regulations, and this is just general requirements for informed consent, there must be a description of any reasonably foreseeable risks or discomforts to the subject. And this must be provided to each subject as part of the informed consent process. So this legislative requirement was not sustained throughout the informed consent process of Jesse's clinical trial, and he was not told about the other participants who experienced severe side effects or the monkeys who died from blood clotting disorders and severe liver dysfunction after receiving the high dose of adenovirus. So these outcomes were important for the researcher to include in the informed consent with Jesse, considering the legislation requirement of explaining any reasonably foreseeable risks to the participant. And then by withholding this information, Jesse was unable to make a knowledgeable decision about participating in the clinical trial. So this compromised his autonomy as a participant because he was not given all information required in the informed consent process.
All right, so implications of nursing practice. So I also talked about informed consent, but we'll just kind of get into it again. So this was obviously a huge issue within the case because there was a lot of vital information that was withheld from the patient, Jesse, and his family that could have changed the decision to go through with the trial in the first place. And I know we talked about the code of ethics. Francesca touched upon them, but I just thought I would bring up another one that has to do with code of ethics for informed consent. So provisions 1.4 is the respect for human dignity, which requires the recognition of patients' rights and the right to self-determination. Patients have the moral and legal right to determine what is best and what will be done for them. And in order to do this, they must have a complete and understand all the information that's given to them. And this also includes benefits, burdens, and available options for treatment. So this code of ethics relates to the implications in medical practice. There wasn't necessarily, I feel like, anything in the case study specific to nursing practice. So just for medical practice in general, Jesse made a decision to go through with the gene therapy trials. As he had said, he had hoped to help the babies, but he and his family were not told that monkeys died from gene therapy due to liver failure, blood clotting disorders, coma, and eventually death, which is also what he experienced. And then that also other humans had experienced strokes and serious side effects from the gene therapy. The doctors were performing the trial. They were aware of the deaths and the serious side effects from the gene therapy. And while performing the trial, they did not inform Jesse and his family of these. So this is not disclosing the information to the family in order for them to make a sound judgment on what they want to do for his medical care. And this is against the FDA regulations because they protect, the FDA regulations protect against human subjects without informing the family and the patients of the serious side effects and potential deaths. So this goes against medical implications because healthcare providers must provide patients with all the necessary information and verify their understanding. And like I said, they gave no specifics in the case study about the nurse's role, but just to talk about like the nurse's role with informed consent. Their role is to witness the client's signature and ensure the informed consent has been appropriately obtained. Jesse and his family were not able to complete informed decision-making because they were withheld information about the potential changes that they could have gone through with the gene therapy trial because he was living with a rare condition that he was able to manage his symptoms and was asymptomatic.
Okay, so we have two content-related questions. The first question is, a 15-year-old patient with bipolar disease has been advised that a new research drug trial may help relieve the distressing symptoms the patient has been experiencing. The nurse needs to gather informed consent, but there are a variety of factors to consider and review with the patient and family or legal guardian. The nurse was recently hired a month ago with no prior experience and unsure of the informed consent research trial and hospital protocols. So explain one ethical and one ethical approach the nurse can take in this situation. So for the ethical approach, the nurse would realize that this was not an assignment she was prepared for or knowledgeable of. So she would speak with her charge nurse or unit manager to ask to be placed with a different patient. And according to the Code of Ethics for Nurses, nurses accept or reject specific role demands based on their education, knowledge, competence, and experience. And for an unethical approach to this, the nurse would have explained the drug trial and obtained informed consent despite having limited knowledge on the research, informed consent process, or hospital policies. This would be an unethical approach due to the nurse's lack of knowledge regarding the drug trial and the need for a physician to initially explain the study and answer questions asked by the patient and family. And a medical provider is required to obtain informed consent in order for the patient to make an autonomous decision. If the nurse was well versed on the subject matter, they'd be able to answer questions regarding the study once informed consent was obtained in the presence of a provider. And then for the second question, a messenger carrying a gift basket exceeding $250 of goods from a drug company is brought to a cardiac unit in the hospital addressed to the nursing staff. This gift basket consists of food, beverage, Dunkin's gift cards, and pamphlets about the new cardiac medication they're promoting along with sample packets. So explain one ethical and one unethical approach the nurse manager can take in this situation. So an ethical approach would be for the nurse manager to first confirm the hospital's policy for receiving gifts. And then depending if the hospital is public or private, there may be different rules. Private hospitals can take certain monetary gifts and public cannot. So the ethical approach would be to respectfully decline what the messenger has delivered if this is a public hospital, and then contact the company to explain why the unit cannot receive the gift. It's unethical to accept such a large gift from a drug company because any form of endorsement of a product causes bias within the unit. And then the unethical approach would be for the nurse manager to accept the delivery and encourage employees to enjoy the food, beverage, and gift cards. This is unethical because the ANA Enterprise Code of Ethics specifically states employees can only receive a non-monetary gift of less than $250. And then the gift must be reported to the corporate compliance office.
All right, so just to wrap up what we just talked about, so 18-year-old Jesse is diagnosed with OTC deficiency at the age of 2. He outlives the normal expectancy for this disorder because he is able to manage his symptoms and disease through a specific diet and medication. When Jesse turns 18, he is approached with a genetic trial from his pediatrician, Mark Batshaw, that he has the potential to correct his OTC gene. Jesse is aware that this is a trial treatment and claims that he wants to help the babies because the trial was originally to help newborns with this fatal disease. Jesse receives treatment from the doctors Steve Rappert and Jim Wilson, and within 4 days of treatment, Jesse develops serious symptoms, goes into liver failure, develops blood clotting disorder, and develops respiratory distress syndrome and dies. Jesse and his family were not made aware of the side effects of this treatment and that monkeys during the trial developed the same symptoms and died. Jesse and his family were also not made aware that humans during this trial also developed serious side effects from the treatment, where 1 died and 2 developed strokes. Without informing Jesse and the family about the serious side effects and deaths from the trial is a violation of the FDA and goes against the code of ethics to fully disclose all of the information for the patient to make a sound decision in their care. Many ethical issues have arisen from this case in terms of medical management, informed consent, and the outcome with Jesse's life. This case study also brings up many other ethical issues and considerations about promoting and marketing gene therapy trials versus the serious effects this trial ended up having on Jesse's life. All right, so we have our discussion questions, so we'll just quickly show our references. All right, so I came up with some of these discussion questions that we can kind of dive into and talk about. So the first one is, do you think that any or all of the doctors, Mark Batshaw, the pediatrician who suggested the trial, Jim Wilson, who ran the gene therapy lab, and or Steve Rappert, the surgeon who administered the gene therapy, are at fault for the death of Jesse Gelsinger?
Yeah, totally. Because they all knew what the risks entailed and they just didn't do anything about it. They were more like financially invested in what that would be. And they didn't,
Yeah, I agree. I think that, I mean, there was obviously some gray areas in like the information we had to like work with, but I think that they seem to be more focused on the financial compensation and like pushing the gene therapy trial forward than how it would actually like affect Jesse's life, especially since it was initially supposed to be for like babies.
I was gonna say, I think less the pediatrician, because he might not have been too involved, or he might have only known the basics of the trial and just suggested it. I mean, we don't know that for sure. He could have been more involved, but I'm just trying to make an assumption here. But I don't know. I would say more so Wilson and Rappert were a little more involved in this one.
Yeah, that's a good point. Since he's just a pediatrician, he might have just heard about it and suggested it to Jesse because he knew Jesse had the same genetic condition. All right, so question number 2. Although Jesse agreed to go through with the gene therapy trial, do you think if he knew that the monkeys died from liver failure and blood clotting disorders and other humans died, had strokes, and had serious side effects from the same trial, he would have still gone through with it?
I kind of think that he would have. And the reason that I say that is because he was already willing to do something for babies. And like, it wasn't even going to impact his life at all. So I think like one, he's 18 at this point. So he's young. He's like, oh, I've lived my whole life. I've done a great job like doing his just like regular medications and keeping up with managing his disease. So I feel like he still would have done it, even knowing that there were a lot of risks.
I think that that might have been enough information for Jesse to deter him from doing it. Knowing that another person died from the same study after having such a rare disease your whole life and surviving it for so long, I just don't think he would have like risked his life like that.
Yeah, but even if he's young and reckless as an 18-year-old boy, he probably thinks he probably would have thought he was invincible.
I could see that too, for sure.
Yeah, that's a good point, Sarah. I mean, I think my initial thought was just like, no, he probably wouldn't have gone through it. But yeah, you're right. He could have just had the mindset of like, no, I've already overcome a lot of odds with this disorder. So like, what's another one? But does anyone else have any thoughts on that one?
Yeah, I see both sides of that. I agree with you, Sarah. I think I could totally think of an 18-year-old boy thinking they're invincible and like the one that would be able to take it and like live through it. But I also think that the same like 18-year-old boy, like deep inside him would be, or anyone would be like scared a little bit hearing all of that. Because I know I would, and it would probably change my mind about going forward with it. So I don't know, it could go either way.
Did it say somewhere in the clinical trial how long people with this usually live?
I think they only live. Oh, you mean from the gene
The
therapy?
case study. No, I'm sorry. Like,
Oh, the
I
deficiency?
thought it said something like most people don't live that long with this. Or am I
2
thinking of something
years
else?
old.
Yeah, 2 years old. So
So
he
2 years and he's 18. So I honestly think that might play in like Sarah's argument. Whereas like
Yeah.
he might understand that he's lived to be 18 when most people get 2 years at most.
Right.
It's like kind of his way of giving back for being lucky. I don't know.
Yeah.
I get it.
I get both sides.
Yeah, same.
Yeah.
All right, next question. Do you think that Jesse's family should have been more involved with the decision-making process of going through with the gene child therapy since it was initially proposed to him at the age of 17?
I'm
I
gonna
think-
say yes.
Yeah, I agree. I think that if it's, especially since it said that he had a very like involved and supportive family, I think this was such a major life decision that the family just should have been just as informed as Jesse was before starting the trial.
Yeah, I agree. I was like thinking about it even back to the pediatrician. Like, I know that again, there's some gray areas, but I feel like he was 17 when the pediatrician proposed this to him. Like, I feel like that was something he should have spoken to the family about first. Obviously, like when he turned 18, he can make his own decisions, but I just feel like there wasn't a lot about his family in the decision-making process, from like what I read besides what they gave us to read about.
Yeah, I feel like even if I had like a 17-year-old kid, I would want to know what they're getting themselves into, regardless. I mean, even if they were 18 and they were making their own
yeah.
decisions, like I would still want to know, like, all right, what is this? Have you looked into it? Are you doing your own research?
Right.
Yeah. And if
I-
I was that parent, I guess that part of this case is that the research that ended up coming out wasn't out yet. But I'm thinking if I was Jesse's parent and he was like, oh, mom and dad, like, I want to do this, I would learn everything I could about that study. And I would be like, oh my gosh, like, I don't know. And if they already knew that he had a liver issue, I think that the study, it was already proven that it would mess up your liver, right?
Yes, I think they did. I think they thought they didn't realize it would put him into liver failure. I think they
Right.
thought it would cause
So
like
it would have an
mild.
effect.
Yeah. And the other thing I was thinking about too is with the family, I mean, he was able to manage his symptoms and live. So, I mean, I don't know. I feel like as a family member, I would be like, well, we figured out what works for you with this. We don't necessarily need to cure you. because, that's risky. So,
My other view on the family part would be that usually families who have children with special needs or children with problems from birth are like specifically very, very careful with their kids. So I couldn't see parents of somebody who had a baby that was supposed to die be like, yeah, you can join this study that has like possible side effects that could hurt your health. I feel like those parents would be like, yeah, we need to protect you at all costs. Maybe you shouldn't do this study.
That's like a really good point. I didn't even think about that in terms of like, do we know if he got input from his parents? Like, did he seek any other people's opinions about doing this, or was it just like he just decided to do it and that was it?
I don't know. I feel like I tried to read online about stuff. Honestly, the only articles I found where it had really anything about his family was like there was that New York Times article, and it like started off talking about his parents burying him. I don't know if anyone read.
Yeah.
That was kind of it. So I don't know. All right. So question 4. Do you think that the doctors involved with this case were more concerned with the compensation/marketing for the gene therapy trial through the University of Pennsylvania than the serious side effects the trial would have on Jesse's life?
Like from the information that we got from the case study, it appears that way because they talked about the financial like investment they made in this specific gene trial. I feel like it kind of goes back to number 1, like they were responsible because they went through with it and
Right.
yeah.
Yeah, I think the lack of like information they were giving to Jesse and his family in general kind of points to like there had to be something else. Like, I don't know, I feel like there had to be something else with the compensation or like the marketing for their trial to succeed, or just to get participants involved, that like there had to be some reason for them to withhold information like they did in this case.
Yeah. I mean, it makes me wonder, like, although they knew about the side effects, if they were kind of like just very eager and more concerned with like thinking of the long-term outcome of like, oh, we could cure this gene, but not really stopping and thinking about like, wait a second, we were like, this was initially supposed to be for newborn babies, but they said that they didn't test them on that because they felt like families and parents making a decision about like their dying child's, they couldn't make that informed decision. But I feel like that's kind of like funny because then, did Jesse get to make a true informed decision because they didn't give him information? So I feel like they might have been like too many steps ahead, focusing on like the long-term outcome of the study versus like, is this what's right for Jesse?
Yeah, I think that they were just willing to take a risk in general, kind of like what
Yeah.
you're saying, because it was more about figuring out the science than protecting one person, which
Mhm.
is very sad. But this happened, what, over 20 years ago? So I know that there
Yeah.
wasn't that much going on with gene therapy then. And then after I was reading one of the articles, after this happened and Jesse died, it shut down UPenn's whole genetic testing facility for a really long time. And there was like a really negative connotation with gene therapy and gene testing. So
Interesting.
I think they really wanted this to go well, because in that same article that I was reading, the doctor says like, oh, like, we had no idea that this was going to happen, like they're taking responsibility. And I think one of them got in a lot of trouble, or at least he had a huge fine.
Hmm.
And then it shut down their whole thing at UPenn.
Yeah.
But yeah, in my mind, they knew what they could get out of it and probably all the money they would make, and they were willing to take the risk.
Right. So question 5 is kind of like goes along with question 4. It's just like, do you think any previous bias mentioned could have led to information not being disclosed? So we kind of talked about that a little bit, about like the compensation and going through with the gene trial therapy. But, I wonder, do did they know in their head and say, we're not going to give him this information so we can go through with it? Or was it overlooked because they were just so focused on that like gene therapy trial and pushing it out? What do you guys think?
I think that they probably put, I'm so sorry that it's so loud. I think they probably put a lot of time and energy into the gene therapy trial and we're so excited to have a possible person who would take part in it. So that could have led them to want to withhold some information about the negative effects that it had on the animals and other humans.
Yeah, that's actually a really good point. And then it made me think of what Sarah just said. Oh, this took place 20 years ago. I mean, gene therapy wasn't really a thing back then. It was just kind of on the coming up. So, you know, if this all went well, they could have been pioneers in that entire industry, and they could have been the ones to kind of start everything and build off of that. So they certainly had a lot to gain. But yeah, that's probably why they didn't disclose a lot of the information.
I bet that they thought that they would get away with, like, I don't think obviously they didn't want Jesse to die, but already knowing that a few people had experienced side effects, I bet they were hoping that, that would just continue to happen and everyone would just get like a little sick. And then they'd have this groundbreaking research and they'd be famous and they would have changed the world. But then what happened to Jesse, like, obviously changed that completely.
And I'm sure when they're doing these clinical trials, they go into it knowing that not everyone's going to benefit and it's not going to react perfectly with everyone. So like you kind of expect some side effects or some hiccups, but obviously you don't expect deaths.
Yeah.
Right. And wasn't this like, I feel like I read this somewhere, maybe you talked about it, AJ, like there's been deaths before from gene therapy trials, but they're never reported as the reason for death. They're reported from like their complications from the gene therapy. So, it makes you wonder like how many more have there been that this has been the same situation, but this is just like the first one that's kind of actually been reported as the cause of death.
Yeah.
All right, good job, guys. So those are references again, and I can stop sharing my screen.